We've got decades of data showing that these vaccines are safe. Why take the risk?
Some local pediatricians and health officials are pushing back against the new CDC guidelines, cutting the number of recommended vaccines for children. The new CDC recommendations were released this week, but Wave News reporter David Mattingly finds that some doctors are sticking with recommendations from a different long-trusted organization.
That's right, Brian, and that is the American Academy of Pediatrics. This has become a conflict between pediatricians and policymakers. At the Kaplan-Barron Pediatrics office in Hikes Point, doctors are suddenly spending a lot more time with questions from parents about childhood immunizations.
Started yesterday, started getting several questions. I'm getting questions from every newborn baby. I had 3 in the hospital this morning to round on. They're all asking about the hepatitis B vaccine, and they're really leaning on us, like, what's your impression?
The questions erupted after the CDC recommended all children get vaccines for just 11 diseases, down from the previously recommended 18. The move conflicts with the agency's own reports. This one from 2024 praises childhood vaccinations as having prevented 508 million cases of illness, 32 million hospitalizations, and 1.1 million deaths among children born in the previous 30 years.
It's like, why take that risk when we've got decades of data showing that these vaccines are safe? Why take the risk?
Baum is among pediatricians rejecting the CDC and relying on widely accepted recommendations from the American Academy of Pediatrics. On its website, the Academy strongly recommends immunizations as the safest, most cost-effective way of preventing disease, disability, and death. Academy charts also show when vaccines are recommended, as timing is critical to prevention.
Delaying vaccines does put children at risk because the way that the schedule has been set up is to protect children from diseases when they are most at risk for those specific diseases.
Local public health officials are also rejecting the CDC changes to the recommendations. In a statement, Metro Public Health Director here said it will, and quoting here, it will increase vulnerability to vaccine-preventable diseases among children, causing unnecessary suffering and possibly even death. Reporting live, David Mattingly, Wave News.